Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the neuroanatomy of the hypoglossal nerve. The hypoglossal nerve is also called the 12th cranial nerve. This is a motor nerve. It is GSE, general somatic efferent. Efferent means motor, somatic, it is supplying the skeletal muscle of the tongue. So it is general somatic efferent nerve. It innervates all the muscles of the tongue. All the muscles of the tongue means that extrinsic muscle, intrinsic muscle. Extrinsic muscles are the Genioglossus, Hypoglossus, Chondroglossus, Styloglossus, Palatoglossus. Intrinsic muscles are the superior longitudinal muscle, inferior longitudinal muscle, transverse muscle, vertical muscle. So all the muscles are getting innervation by the hypoglossal nerve except the palatoglossus, which is innervated by the vagus nerve via the pharyngeal plexus. Hypoglossal nerve is located beneath the floor of the fourth ventricle. Fourth ventricle is located between the posterior aspect of the brainstem and the anterior aspect of the cerebellum. The tongue receives corticonuclear fibers from both the cerebral hemisphere. Corticonuclear fiber, that means these are the upper motor neurons. In case of genioglossus, it get the connection from the contralateral corticonuclear fibers. So let's start from where we will get the hypoglossal nerve. These are the rootlets of the hypoglossal nerve. It comes out from the anterolateral fissure, the fissure or sulcus between the pyramid and the olive. This is the olive. It looks like olive because it contains inferior olivary nucleus. It looks like pyramid because it also contains pyramidal tracts. Okay, so this is the hypoglossal nerve rootlets. This is the hypoglossal nerve. That nerve innervates the muscles of the tongue with exception, that is the palatoglossus. Okay, we got that. Now go to the next slide. Okay, so it comes out of the anterior surface of the medulla oblongata between the olive and pyramid. We just discussed that. This is the pyramid, this is the olive. Olive containing inferior olivary nucleus, crosses the posterior cranial fossa and exits the skull. Exits means that it leaves the skull. It is coming out of the skull through the hypoglossal canal, passes downward and forward between the internal carotid artery and internal jugular vein to the inferior part of the posterior belly of the digastric near the angle of the mandible. Okay, remember, posterior belly of the digastric is innervated by the facial nerve. Okay, the hypoglossal nerve crosses the carotid arteries, that means external carotid artery, internal carotid artery, and the loop of the lingual arteries, and passes deep to the and to the loop of the lingual artery on both side arteries. One lingual artery passes deep to the posterior margin of the mylohyoid muscle and branches of the muscle and branches to the muscles of the tongue. So here is our hypoglossal nerve. Okay, here look at that. Here it is deep to the posterior margin of the mylohyoid but superficial to the hyoglossus muscle, and it will branch out and supply all the muscles of the tongue. In the upper part of the course, the hypoglossal nerve is joined by C1. This is C1. Fibers of the cervical plexus. The C1 later leaves it. C1 just gets support from the hypoglossal nerve. There will be no mingling of nerve fiber. C1 supplies different group of muscles. like that of the geniohyoid muscle and the thyrohyoid muscle. And C1, C2, C3 are essential part to supply the hyoid muscles. Okay, the ansa cervicalis is from the loop of nerve over the wall of the carotid sheath. Okay, it will supply the suprahyoid, infrahyoid muscle like that of the, this is the, we are looking at the muscle here, the omohyoid muscle here. Okay, and we have the superior belly, inferior belly. Here we got the geniohyoid muscle, we got the thyrohyoid muscle. Okay, so these are innervated by the ansa cervicalis. We'll not go there. We'll go to the hypoglossal nerve. It is just giving support to the C1. Okay, there is no mingling of fiber. Fiber are not mixed up. Okay, just getting support. Okay, we got that. Hypoglossal nerve regulates the movement and shape of the tongue. Okay, we got that. We got the nucleus here. This is the fourth ventricle here. Fourth ventricle. Here is the nucleus of the hypoglossal nerve, and the muscle fiber to the genioglossus is getting contralateral corticonuclear fiber. This is contralateral fiber here. Okay, other muscles of the tongue will get bilateral contribution from both the cerebral hemisphere, but in case of genioglossus, it will get contralateral connection to the contralateral cerebral hemisphere. That is the the cerebral cortex corticonuclear fiber. Okay, we got that. Now we'll go to the examination of the hypoglossal nerve. How can we examine the hypoglossal nerve? Okay, as a physician, patient is asked to protrude the tongue straight out and from side to side. Okay, so this person can stick out the tongue very nicely. He can move the tongue side to side, so everything is normal. We have two types of lesion: upper motor neuron lesion from the cerebral cortex to the hypoglossal nuclei. If there is a lesion there, there will be spastic paralysis. There will be muscle will be like spasm. Okay, and there will be contralateral deviation. Although most of the muscle has bilateral connection, but the bulk of the muscle is the genioglossus. That is the most important, the bulk of the muscle. So there will be contralateral deviation in upper motor neuron. Upper motor neuron is the from the cerebral cortex to the nucleus. Nucleus is located in the floor of the fourth ventricle. This part from cerebral cortex to the nucleus of the hypoglossal nerve is the upper motor neuron. Lower motor neuron from the nucleus of the hypoglossal nerve at the floor of the fourth ventricle to the muscle, there is the lower motor neuron lesion. The lower motor neuron, if there is lesion there, there will be flaccid paralysis and ipsilateral deviation. Okay, so just look at this person here. Suppose this is left side, the muscle is atrophied. Okay, and there will be rough here, rough, the smoothness will be lost, and there may be fasciculation. Okay, there will be fasciculation, and when the person protrude the tongue moves towards the paralyzed side. Why? Because we have a septum in between the tongue, and this side has no resistance. When he's sticking out tongue is moving towards the unresistant side. This side is not giving any resistance. It is atrophied. It has no strength. So this normal side will push the tongue towards the paralyzed side. Okay, we got that. So this is the examination. Before going to end of this, person with the paralysis of the hypoglossal nerve will develop dysarthria, difficulty in speech. Okay, if you ask the patient to utter this word L, T, D, and he can't. Ask him to say lala, he cannot make lala. Tata, cannot do tata, cannot do dada, where we use the tongue. Nana, he cannot use this word. Okay, that means his tongue is not working. So that will lead to dysarthria, difficulty in speech. Okay, particularly in case of we have many causes of dysarthria, maybe due to the 9th nerve, 10th nerve lesion. If you ask the patient to say ke, to stop or close the glottis, that is the that is the 9th and the 10th cranial nerve. Okay, if you say the patient to ask the word me, that will indicate the dysarthria due to facial nerve paralysis, because he cannot use the orbicularis oris muscle. Okay, but in case of hypoglossal nerve related dysarthria, we have problem in the L, T, D, and N. Okay, we got that. And that's all about the neuroanatomy of the hypoglossal nerve. Again, please know what is upper motor neuron lesion, what is lower motor neuron lesion. What is nuclei? Nuclei is the collection of nerve cell in the central nervous system. What is ganglia? Ganglia is the collection of nerve cell outside the central nervous system. So where is the location of the nucleus of the hypoglossal nerve? In the floor of the fourth ventricle. Okay, from there we'll get the lower motor neurons. Upper motor neuron comes from the cerebral cortex. Okay, to the nucleus of the hypoglossal nerve in the floor of the fourth ventricle. Okay, so that's all about the neuroanatomy of the hypoglossal nerve. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me, and have a wonderful day. Bye now. Take care.